Welcome to PHI, Public Health Impact. I'm Phaedra Corso.
And I'm Cham Dallas, and today we're going to be looking at careers in public health, focusing on the alumni from here in the College of Public Health at the University of Georgia.
And Cham, I'm going to be talking to some of our alumni from health promotion and behavior, from epidemiology, and from toxicology.
And we're going to be talking to people from different areas of the country, right here in Georgia, of course, Florida, all the way out to the West Coast.
And Cham, I'm also interviewing Dr. Joel Lee, who is our Associate Dean for Academic Affairs, and Joel's going to give us his unique perspective on what the future of public health looks like for careers.
And these are real-life examples in public health, which is a unique career path where people really want to make a difference.
Joining me now is Dr. Joel Lee. He's the Associate Dean for Academic Affairs in the College of Public Health. Joel, thank you so much for coming in today.
Great, it's my pleasure to be here.
So as you know, this show is on public health careers, and a little bit later on we're going to be talking to some of our alumni. I want to start off my questions for you on just what does our student body look like in the College of Public Health?
Certainly, as you know, the College of Public Health awards degrees at 3 levels, the baccalaureate degree, the master's degree, and the doctoral level. We have 2 very large undergraduate major programs in environmental health science and health promotion and behavior. We have a new undergraduate minor in public health that's open to students from across the campus. It began a year ago and it's grown to 100 students in a very short time. At the master's level, our primary activity is the Master of Public Health MPH degree. We offer that in the 5 concentrations within the college. In addition to that, we offer both doctoral education preparing people for teaching and research through PhD degrees, and the DRPH degree preparing people for senior level leadership roles in practice.
Okay, well let's talk a little bit more on the graduate level than undergraduate for a moment. Are we attracting the same kinds of graduate level students in public health that the rest of the schools of public health are?
We are participants in a national centralized application service, which is beginning to give us data comparing our applicants and our offers of admission to other schools. I would say we are on the par with our aspirational universities. We are admitting very good students. They have very diverse backgrounds. We're predominantly students coming straight from undergraduate school. We do have some part-time students, non-traditional students, but at the master's level, most of our students are coming out of undergraduate programs in a variety of areas.
So give me some, I know health promotion and behavior is one of them since we have an undergraduate program that's feeding into our MPH, but what are some of the other backgrounds?
Sure. We have students coming out of the social sciences, sociology, the humanities. We have students coming out of the sciences. In many cases, students coming out of the sciences have interests in careers related to clinical professions, and they seek to blend their public health degree with veterinary medicine, pharmacy, nursing, MD programs.
Mm-hmm. And are there certain requirements to get in? Like, do they have to have certain science classes to get into the graduate programs?
The MPH program does not have prerequisite requirements. We are part of the University Graduate School. All of our applicants must take the graduate record examination and comply with standards that are set by the graduate school. In some cases, they have the opportunity to use a standardized test for another profession. In addition to that, the graduate school sets a standard for an undergraduate grade point average of a 3.0, and for students who've already pursued graduate education, a grade point average of a 3.5.
If someone wants to come into our program, into one of our graduate programs, what is the schedule for looking at applications?
We're currently doing our admissions process. It is open through April 1st of this year. We require students to complete an application through the university along with an application through that national centralized service. If anybody's interested, we'd be delighted to talk with them and explain the process in detail.
Now let's say the students are here, they've received an incredible education with us in our graduate programs, and now they're out looking for a job. Where do MPH students or some of our PhD, DRPH students, where do they land once they finish?
There are a variety of opportunities. It's in contrast to some academic programs where all graduates do the same thing. our students are spread across the spectrum of careers. Frequently people talk about graduates in public health working exclusively in the public sector for the federal government, CDC for an example, state government, the state health department, local government, local health departments. A significant number of public health graduates are also employed in the private sector.
So give me some examples of private sector jobs that they might get.
Environmental health, wellness programs, hospital administration. There are just a number of opportunities for students with a background in public health.
Joel, one more question before you leave. Tell me about the exciting move of the College of Public Health.
Well, as you said, it is extraordinarily exciting. As a young college, we're spread across 8 locations, both off campus and on campus presently. As you know, the U.S. Navy Supply School has left its site on Prince Avenue, and along with the medical partnership, the College of Public Health will be occupying buildings there, both for offices and classrooms. Our Department of Epidemiology and Biostatistics recently moved as the first of our efforts. Later this spring, we will see our Center for Global Health make the move to a new location. We will begin teaching a substantial number of our classes at the Health Science Campus this coming fall, and we're now currently working with logistics of on and off campus activities, including bus service.
Well, as one of the departments that's going to be moving out there, we're really looking forward to it.
And we're going to have newly remodeled classrooms, so I think the students will enjoy that
That's
as well.
great. Thank you so much for your time today.
Great, thank you.
Our next guest is from CDC, John Anderton, and he is the Associate Director for Communication Science in the Epidemiology and Analysis Program Office. Thank you so much for coming today, John.
Thank you.
I am so eager to talk to you because you're working at CDC where I used to work,
Right.
and I understand that you came back to the University of Georgia for long-term training, and so I guess I'd like to first ask you about your interest in public health. How is it that someone who has a master's in public administration, how did you land at the CDC?
I joined CDC in June of 1991. I came to Atlanta because I met a beautiful girl at a wedding a year before. And after marrying her, relocated to Atlanta and almost immediately found the job at CDC, working in the office of the director, writing speeches for Dr. Roper and articles for the Dateline, which was our internal newspaper at the time.
So what kind of training did you have in your MPA program that prepared you for that position?
I had started an MPA when I was still back in Wichita. And when I came to CDC, I finished it at Georgia State University with an emphasis in the actions of public and urban administration, so contracts administration, sort of the budget side of things. At that time, the part of CDC that worked in childhood immunization really ramped up because President Clinton decided to create the Childhood Immunization Initiative,
Right.
which was a vast opportunity to promote childhood immunization. And because of some of my experience with budget and interest in communications, I moved from the Office of the Director over there in communications. And we did huge campaigns, TV, radio, posters. It was a lot of fun. So that's how I applied the public administration degree.
You didn't start off with an interest in public health, but kind of landed there. What made you decide to go on and get a PhD in health promotion and behavior?
In 1995, Dr. Vicki Frymouth came to CDC to be in charge of communications. And she had a PhD, and in the Office of the Director, the tenor was changing to more professionalization of the staff. And she gave a great lecture, I remember it very clearly, where she said, if you want to go places in the world, and especially at CDC, you need a terminal degree.
Right.
So I went and talked to her after that. What does that mean? How does that work? And a friend, Kathy Wilson at CDC, talked to me after that, and she said, well, my husband Mark's over at UGA, why don't you go talk to him? And so I got immediately interested in UGA. I applied for long-term training. I was lucky enough to be selected.
And so just so we know what long-term training means, what does that give you?
It's basically an opportunity to draw your full salary while going off to school for 2 years.
That's great. And so what were some of the classes that you had in your PhD program, or some of the areas that you focused in that you really, you fell in love with and you said, this is why I'm here?
This could be a very long answer. My degree was put together out of several schools here. The J School, journalism right here. Those classes focused on applications of health behavior theories. If you want to change someone's mind about smoking, How do you do that? How do you make them want to stop smoking and not preach at them? Wear sunscreen, mammogram, seat belts, those kinds of behaviors. I took classes in rhetoric and theory over in speech, and that was the higher order. What are the theories that would describe how people would choose to take those healthy behaviors and actions? Don't let me forget to give a shout out to the people over in health promotion and behavior. As much as I enjoyed speech and journalism, the nucleus of the program before the School of Public Health arrived at UGA
All right, give us
was over there.
Give us that shout out now.
The folks like Stu Forers, Dave DeJoy, Mark Wilson, and others form the backbone of the EPI classes, and a whole array of love of the topic that was really a very nice convergence with what CDC is about.
And
So-
what's interesting about that is you graduated with your PhD from health promotion behavior before they became part of our
That's
new
right.
College of Public Health.
They were just plowing the row toward that.
You've been out of school now for a while. You have a PhD. You're still at the Centers for Disease Control and Prevention. How has your PhD changed your role in the organization? Like when you came back, did you go into a new position or did you stay where you were?
When I came back to CDC, CDC chose to put me in a different area where I actually stayed for 7 years, and that's the area that had HIV, STDs, and tuberculosis in it. And that was a fascinating program. They had a huge mandate, some extremely different types of diseases, but a similar way to attack them through health promotion. And I worked in communications there through the end of 2007, and I had a ball. It was very difficult, very interesting work.
I love that you've shown that the skills from health promotion and behavior can be applied to any health outcome you can possibly imagine. And in your career at CDC, you've gone from one health area to another. That's very interesting.
I don't know if that means I can't keep a job or not, but
Last question here. Tell me why our students should want to work at the Centers for Disease Control and Prevention.
CDC has a mission that involves 140-ish different occupations. So whatever your angle coming through public health is, you can probably find a place at CDC to exercise it and practice it. And the decisions that you contribute to have actual impact in people's lives. It's not esoteric or what if. These are interventions, these are deep statistical methods, a variety of ways to apply your knowledge to advance public health. And it is a tapestry kind of thing. Each of the different types of careers really weaves together into a very coherent whole. And I feel good about the mission. I've always felt good about it. You can apply those skills to different topic areas, and I've had the pleasure of working in the Office of the Director, where you have to kind of keep an eye on all the disease areas, and then in some very specific stovepipes also. And you do feel sort of connected. I like that you can say hi to people and not be scared of going to the Office of the Director, because you know you're in the same mission business.
Right.
And that's a nice organic kind of feel to it.
Well, great.
I don't know if that's a very good answer to that. But
It's an excellent answer. Thank you so much for your time.
thank you.
Now let's talk to one of our recent graduates, Jim Mathias. Thanks for coming in today, Jim.
Thanks for having me, Dr. Corso.
So tell me, what program did you graduate from here at University of Georgia?
I graduated from the epidemiology program.
In the Masters of Public Health?
Correct.
Okay, and so you graduated last May, is that right?
Yes, I graduated last May, and it was a pleasure.
Okay, and tell me, where are you now?
Right now, I am at the Florida Department of Health, located in Tallahassee, Florida. I'm doing a CDC CST Applied Epidemiology Fellowship there.
Okay, and tell me, what does CSTE stand for?
CSTE stands for the Council for State and Territorial Epidemiologists. They're the ones who put this program together, and it's funded by the CDC as a joint collaboration to help train future epidemiologists.
Okay, and the fellowship program runs for how long?
It's a 2-year program, and it's designed to work for people who recently graduated with master's or doctoral degrees to get out in the local and territorial level of epidemiology.
Excellent. And so what are you doing in Florida's Department of Health?
I work in the zoonotic and vector-borne disease division, and that means that I work with tick-borne and mosquito-borne diseases, such as dengue, West Nile virus, Lyme disease, and I do surveillance and outbreak investigations along with many of the local county health departments, workers, and other people at the State Department
Okay,
of
so
Health.
if I get bitten by a tick in my backyard in Florida, do I call you? How does that work?
Well, you wouldn't exactly call me. You would report it to your local county health department, and part of surveillance would be that they would track the numbers and do the case reporting and do the investigation at the local level, and then they would aggregate the numbers here at the state level. And I offer assistance to the local health departments when they need assistance in things like Lyme disease or Ehrlichia or other tick-borne diseases. So eventually it basically would be like you're calling me, because I would probably eventually see your file and make sure that it was counted and aggregated so we can track trends and see if there's any changes going on in Florida.
Okay, and that's the surveillance piece of what you do?
Yes.
Okay, how about the investigation of outbreaks? Give me an example of what you've done there.
Well, I have a couple of really good examples. One outbreak we did was a staphylococcal foodborne outbreak, which is, your basic textbook training exercise that we learned at the University of Georgia, where people were getting sick at a wedding party, and we had to figure out what was causing it and where it was located and what prevention measures we needed to take care of. And that was a really interesting way to learn, and it really was textbook, because we were able to find out what it was and how it was involved.
Okay, so this is shoe leather epidemiology.
Shoe leather epidemiology. We were there, we were interviewing every single case and every single person, which is nice in a wedding party because you're able to contain it to such a small group.
And so you weren't interviewing them at the wedding. This is kind of after the wedding takes place, everybody's sick. And so what kind of questions do you ask them?
We asked them what kind of foods they ate. We asked them when they got sick, if they noticed anyone else getting sick, in case maybe it was brought into even before the food or anything else that was associated with it. And if you figure out what people were eating, you can figure out what else didn't cause people to get sick, if they didn't have certain things or if they had other things. We asked them what their symptoms were, when they onset, so you can also figure out the timing and incubation period, which is the time from when you get sick to where you start showing your symptoms from when you were exposed.
So other than surveillance and then investigation of outbreaks, what are some of your other roles?
This summer we were able to go down to Key West with Case Western Reserve and the CDC and do a collaboration study on knowledge, attitudes, and practices about dengue in Key West, because in the last couple of years they had over 100 cases of dengue, and since this is a new disease and more tropical global type of health disease, a lot of people in America wouldn't even know what dengue fever is. So we wanted to understand how much they've learned and how much their behavior has changed to help prevent dengue from occurring regularly in Key West.
Okay, so I know nothing about dengue. I'm assuming it's transferred by mosquitoes?
Yes, it is a mosquito-borne disease, and a big way of preventing it is to remove standing water from your property, because these are container breeding mosquitoes that transmit dengue. And so one of the things we wanted to get out there was make sure people knew that it was transmitted by mosquitoes, and that you can do something in your own yard to prevent the mosquitoes from breeding and causing illness in people and break the cycle.
So how well did UGA train you to become an epidemiologist in the state of Florida?
They trained me very well. They gave me the tools that I needed to be able to get the fellowship, and the tools able to practice epidemiology at the state level of epidemiology. But it's always an ongoing process, and I'm continually learning, and it's a process to always make sure to continue to learn to become the best epidemiologist you can be.
Well, we're very proud of you, Jim. Keep it up. That's great.
Thank you.
Thank
it was
you.
a pleasure.
We're now being joined by Clare Reedy. She's another graduate of our MPH program. Thanks so much for coming in today, Clare.
Sure, thanks for having me.
I know that you're an RN, and so that's another way that someone might come into the field of public health. So why don't you tell me a little bit about that part of your life, and then what brought you into an MPH program?
Sure. Well, I have undergraduate degrees in both political science and nursing, and before grad school I've been working as a registered nurse for a few years on a transplant unit. We mostly treated patients who were rejecting their liver and kidney transplants, so unfortunately I saw a lot of the worst case scenarios for chronic and lifestyle illnesses. Most of our patients had hepatitis C and diabetes and hypertension. And it didn't really take me long to realize that I was way too late to actually make a big difference in my patients' lives. So I thought that transitioning to public health would be a nice combination of my political science and nursing backgrounds, and give me the opportunity to have a much larger impact on health and well-being through prevention.
Great. So I love this example of you started off in the treatment world, but then you're moving back into prevention. That's great. So how long were you a nurse before you came into MPH program?
I was practicing for about 3 years. It was a second career for me. So.
And when you came into MPH, what was the field that you studied?
I studied health promotion and behavior.
Okay, and how was your time here at UGA in that area?
Oh, it was really wonderful. I actually had a research assistantship with Dr. Pamela Orpinas, and one of my first tasks was to help put together a small grant proposal, which got funded. So we were able to implement a community-based prevention program for Latino immigrants around adolescent risk behaviors. When that program was done, we were able to write up the results and actually put together and submit a second and much larger grant proposal to NIH. So it was really a great experience for me to both work in the community and see a research project unfold from day one.
And since then, what have you been doing?
I've been at the CDC in the Division of Violence Prevention.
Okay, and how did you get your job there? That's what all graduates want to know, is how do I get a job at CDC?
Well, and it's actually a series of different positions that I've had there, but always on the same team. So I started before graduation as an unpaid intern, and I got a job working on the social determinants of health equity team in the Division of Violence Prevention within the National Center for Injury Prevention and Control.
Okay, so tell me, social determinants, what does that
Sure.
mean?
Well, so health equity, we're really focused on health equity. So we're concerned with assuring that all population groups, regardless of social characteristics like race, class, or gender, really have the opportunity to attain their full health potential. And adding a social determinants approach really means that we're getting closer and closer to the actual root causes of these health inequities, including violence.
And so certainly your training in health promotion behaviors probably prepared you very well for that type of position.
Definitely.
And what kind of advice can you give to our MPH students who want to work at CDC or have a good career in public health? What kind of advice might you have for them to get into CDC in particular?
Well, it is really tricky. So there's a lot of different ways you can do it. There's jobs that are posted through their website, but then there's also a lot of fellowships that are available. And I went from the unpaid internship to a fellowship that was really not that glamorous. It didn't have health benefits or vacation, but it did give me a chance to continue working there and get paid. And just recently, in September of last year, they offered me a different fellowship. And so now I'm technically an employee of the federal government, and I am an associate service fellow. So this position is really great because it comes with health benefits and vacation and a much longer term limit. So there is a wide variety of ways to get your foot in the door. I actually got my unpaid internship just through networking at a conference.
And I like that you say that it's an unpaid internship because oftentimes you just have to do what you have to do to get your foot in the door.
Yeah, definitely. And I was really lucky because I was able to get my foot in the door of a division that I was actually really committed to the work behind. So,
which I am too. Division of Violence Prevention is where I
Yes,
used to work.
exactly.
So, well, thank you so much for coming in today, Claire.
oh, you're welcome. Thanks for having me.
Thank you. Joining us by Skype, we now have one of our recent graduates, Gideon St Helen. Gideon, thank you so much for joining us today.
Thank you for having me.
So Gideon, I know you're a graduate of the PhD in toxicology program. Can you tell us a little bit about what you focused on in your degree program here?
Okay, so like you said, I graduated from the interdisciplinary toxicology program. It's a program at UGA, and it's one of the treasures of UGA. It's where you have faculty, students, postdoctoral fellows from different departments or different schools in UGA. And then I studied toxicology, but my focus really was on environmental health science. And I looked at outdoor exposure to tobacco smoke or environmental tobacco smoke, measuring the constituents of tobacco smoke in the environment, as well as measuring these constituents in persons, in non-smokers who are exposed to tobacco smoke outside.
And what have you been doing since you graduated?
Well, I finished my PhD in May. I graduated in August, but I started a postdoctoral fellowship at the Center for Tobacco Control Research and Education at University of California, San Francisco. And I'm at a center which is very interdisciplinary, just like our interdisciplinary toxicology program. And I'm more focused on the hardcore science of looking at smokers' exposure to various compounds. So I'm looking specifically at smokers using biological markers.
Well, so the show's about careers in public health, but you're someone who's finished a PhD and is now in a postdoc program. Why not just go out and get a job right after your PhD? I mean, what is your career trajectory that kind of pushes you into a postdoctoral program?
Okay, so I wanted to gain much more knowledge. I wanted to be more competitive, so I thought that by doing a postdoctoral fellowship, I'd gain some more experience in a specific field or more high-tech or more specified experience. Because I'm working with Neil Benowitz, and I'm doing things that I did not do with my PhD. Right now, I'm looking at various biological markers in smokers, things that I did not do while I was at UGA. So I think it's an added benefit for me.
And when you do a postdoc, is the idea that you're going to go into academia someday, or what are your thoughts after you finish your postdoc?
Yeah, actually, I'm thinking about, twofold, whether I should go into academia or probably pursue a career in terms of research at a federal agency like the Centers for Disease Control and Prevention, the CDC, or the EPA. I'd really like to work in one of these agencies, but I also want to go into academia. So I'm thinking about these two tracks and deciding which one to do.
One of my last questions for you are, what are some of the challenges that our students might face when they're trying to get careers in public health?
Right. So I think the challenges that they'll face are challenges that most other persons will face right now in a recovering but fragile economy. And it's mainly, will they be able to get a job after they finish their education? And another challenge, is the cost of education, the tuition costs. For example, most persons who are doing an MPH, they do not qualify or they don't have assistantship, graduate assistantships. So it's much more expensive for them. So, and then for me personally, one of my challenges is deciding whether to go back to St. Lucia, you know, to where I know I'll make a big contribution, or to stay in the US where I know I'll be able to make a better living for myself and for my family. So this is my own personal challenge. And these are the challenges that I think that different persons might face.
Well, no matter what you decide to do, we're very proud of you of being a graduate of our program, so good luck.
Thank you.
Well, today's episode certainly showed me the exciting and interesting aspects of careers in public health.
Yeah, and it was really great to catch up with the alumni and see all the wonderful things that they're doing out there in the world.
Yeah, well, there are such diverse paths and really wide-ranging places. You could be anywhere in the world with these kind of careers. But I did notice that they were enthusiastic about what they're doing, and it had a big impact on people.
And so if people are enthusiastic about public health like you and I are, and they want to learn more about it, you just need to go to www.publichealth.uga.edu and learn more about what we can offer you at the College of Public Health. So join us next time on PHI Public Health Impact.